February 1st, 2017. If everyone can please either silence or turn off their cell phones, and then join us in the pledge. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So Denise, can you go over, we do have changes or additions for today?
Correct. I have no deletions, but several additions. Road Department is going to bring forward a proposal for shouldering machine purchase. We are going to cover the nuisance ordinance and hopefully set dates for our public hearing. Public Health has added an MOU for an immunization grant. Under legal updates, we are going to discuss with legal counsel the ways of necessity brought forward by our assessor, and we had an addition of a right-of-way easement change. That's it.
Okay. So, public comment. We don't have any public here. At 10:05 in a few minutes, have we gotten any word on the auditors and the arrival?
Yeah,
She's here
like a
to
set of heels. I'll watch.
Well, today it's kind of interesting because most of the things, Mr. Bailey didn't feel like it was going to be safe driving to come down today, and most of the other items, if we were to skip down to them, we really wanted to have them
She's here now.
present. So this is perfect.
Morning.
Good morning.
Good morning, how are you?
Just go ahead and grab a chair.
Grab
now
or
we're-
whatever you need to do first.
If you don't mind repeating whatever you talk about in the first 2 minutes, we'll probably open this up to you. Your timed item at 10:05. So if the public comes in and wants to know what you told us for the next 2 minutes. Are you ready?
Yeah, I think so.
Nothing like walking in off the street and getting cold.
I made it on time, I wasn't sure.
Yeah.
I've been burned this morning. Slower to trip, I thought that's the last thing I needed this morning. How she was having them. I think.
Well, welcome. Glad you made it over okay.
Pretty good.
Commissioners had to step out. Do you want some coffee? Want some hot water?
Do you want to be in home?
Let's hope not.
Some Jameson with your coffee?
Not this morning, I think I'm okay. Okay, so I don't know if you guys have the audit in front of you and the letters that we sent.
Yep.
The 3-page letter, this is just our kind of a form letter, called that one working letter. It kind of goes through any of the procedures in the audit and that kind of thing. Really, there wasn't anything in here. If we have any disagreements or anything like that, we have to know that in this letter. We didn't have anything to know in this letter. On page 2, in the middle of page 2, it does talk about looking for estimates and the financial statements.
Carrie, I think that, they might not have that letter. in
Oh,
front of them.
yeah.
This
Okay.
is like a, just the
This is just, and
management.
it's kind of a form letter. It's
Yeah.
just kind of goes through process. It's basically, it's a letter that says if there's any issues with the audit, we have to report it here also. We didn't report anything, so
Okay. Yeah, we've got the December.
you have the management letter.
Yeah.
Okay.
Carrie, would you mind moving that mic over by you and kind of talking to you? So that, these are, meetings are recorded or videoed, and
I can do that.
thank you.
So the management letter that you guys have, anything that we notice while we're auditing, we put in this letter, whether it's little things or big things. Normally we kind of put anything in this letter with the term of holes or any kind of recommendations we might find.
Yeah, we can.
The first section is just a normal boilerplate saying that we look at your internal controls. We don't provide an opinion, but we also don't look at everything because we pick a sample based on risk. So that a higher risk items would take a higher sample to test, and lower risk would take a lower. That way we can get the most riskiest items in our testing a little bit better. The first paragraph talks about internal controls. This is something that we've noted every year. It's just a note that, just to try to make sure you keep segregation of duties separate. There has been voluntary oversight by personnel, so we don't have any huge holes in internal control or anything like that. And just, just to keep aware of and to keep on top of. Especially if you happen to have any switching over personnel or anything like that. It's just very important to keep on top of that. Payroll, we noted that the employee handbook is old and may not reflect the policies, but however, we do know there's an updated process. And so it's good to see that you're proactively looking at those different policies and procedures, especially with the changes in payroll laws and all that kind of stuff. So because of GASB 68, which is a PERS statement, we are required to look at a little more in-depth PERS data. So we have to look at kind of what you have in your system compared to what PERS has in their system. And so out of the 9 employees that we tested, we had a few differences between like the PERS salary and salary in the financial software, and we also noticed one that had a birthday error. So PERS is not a very easy system to work with, and I totally understand that. And that could be parts of it, that kind of a thing, but it's just important to make sure that your PERS data is being recorded correctly.
So was that mine by chance? Because I'd asked Nikki to change it from 1952 to 1960.
I don't believe so, no, but good try.
You'd still be older than me.
Yeah.
I can report though that we did look into that, and there were reports from even years back that were still in suspension, and that has all been corrected. And when you come the next time, it's not gonna be in the fiscal year that you looked at here, but it'll be fiscal year and this fiscal year, but it should correct itself, because we've gotten all of those. Some of them were really, really old and still in some suspension land out there.
Oh, well.
So it's been looked at though and taken care of. We should be correct on it.
And so that's good to know. PERS, that's gonna be even more and more looked at closely because of the cost of PERS. And so it's just good to stay active on keeping all that data current and correct also. Capital assets, we talked about capital assets kind of every year. We didn't have any reports available at fieldwork when we were here in September. However, we did get the reports in the office and were able to test it. And I would note that it was better than last year. We spent a lot of time on it last year. This year was a little bit easier, probably because we spent all that time last year. But it's just kind of a hard thing to keep up on, since really it's only used for audit purposes, because your insurance purposes takes a totally different look at that, like about $500 compared to a capital loss of $5,000. And so it's just something that it's kind of tough to test sometimes for us because of the way the systems are set up with the 2 different systems here. But the more we can improve that, the better we would be. And then the last thing in the letter is the road cost. We just noticed a few discrepancies, very minor discrepancies between the project cost system that the road department uses and the different time cards. So just, and one, there was some equipment that wasn't noted that was used or didn't quite match time cards. So that's something we have to specifically look at because of Oregon standards. So overall, pretty picky management letter, just some little items that we noticed that could be improved a little bit, but very good. So.
Well, I've met with several different departments and everything that's here, which is very minimal, has been looked at and working on the PERS and the capital assets and all that. So I just like to say to everybody who works on that, very good job. An audit is like we talk, and it's our scorecard in a way of how we're doing. So I'm pretty proud of Worth County. So this is a very good letter.
Yeah, and in here it's always good to know if we know anything, usually the next year it's fixed. And so you guys and everybody takes a, very responsibility on that, and it's very, very good to see, so.
Yes, I'm very proud of them.
Yep, I agree.
So that's just kind of the management letter. I don't know if you guys want me to go over any of the audited numbers or anything like that, or if you have any specific questions on it.
When we got it, I thumbed through it. It's a pretty big document.
Yes, it is.
So I guess for me, if there's something that, whether it's Ann or Nikki or anyone else that's reviewed it, or Carrie, if you believe there's something specific that we should.
I'll note that in the audit report, we gave you an unmodified opinion because we didn't have any big issues, and so that's the best you can get. That's basically a clean audit. And the same with our single audit, we didn't have any findings at all, internal control or numbers. And so I will note that in the audit, that's something to change, so that's a good job, everybody.
This single audit is required for our federal expenditures. So
Correct.
that's the federal test of our internal controls and accounting and things like that.
So basically what we do, because you have over $750,000 worth of federal expenditures, we have to take and test certain major programs. So we test major big programs or higher risk programs. And then we have to, if you have any findings that you're not following the grant agreements or they're not being correctly reported in the financial system, we have to report that. So we didn't have anything like that to report. And because of that, this also goes to a federal website, clearinghouse website, so it's available publicly because this is a lot besides Secretary of State website. But really, there wasn't any big changes in standards this year. Last year, we had the huge GASB 68. And I should probably point out on the statement of net position, because of the GASB 68, I know we touched on this last year when I came and presented the audit, because of the Morrow decision last year, after they had already done their calculations on the asset or liability of the pension, that you actually had an asset on your books last year for pension. And this year, it's a $2.5 million liability. And so and that had all to do with the reversal of that decision. And so because of that, it skewed your data big time. But, and then coming down the road, we'll have a new, not this year you're in, but the next year, we'll actually have a new GASB statement also that's kind of follows the GASB 68, the PERS, except for its other post-employment benefits. So we don't quite know how that's going to affect your financial statements yet, but it is something coming down the road that we'll look at differently and probably different tests by auditors too.
You understand all that?
Well, that's gonna be looking at insurance or any other benefits that we would have a liability for a retiree. So in our instance, don't really have that.
Offer that to
So-
retirees.
Well, a lot of them, they let you, retirees, they pay their own premiums, but they, let them stay on the group plan until they hit Medicare age sometimes. And so because there's an applied benefit,
Yeah, okay.
because you get a better rate than you would if you just got it in the market, they want to book that kind of stuff. And so it's not anything you'd ever see financially, really, in dollar-wise, but they want you to show up the financial statement. So we'll see how that goes.
We're already reporting some of that scenario, and right now I think we have one employee that's doing that. Retired and still working just enough to make sure he's always covering insurance that we allow him to stay on until he reaches that age, which is part of that whole Affordable Care Act reporting.
Correct.
Which is a nightmare.
And, GASB 45 should have been placed since, I think, 2012, and that started this whole process, but you guys weren't required to report anything since you were, your insurance plan kind of makes it where there is no cost. And so we'll see if the new GASB statement will actually keep with that process, or we'll find out probably this year what they're gonna do.
So I need to go back, because we kind of skipped right on by the asset, and now the $2.5 million liability.
Correct. On the GASB, and it has to do with,
Page 38.
yeah, the notes are really detailed on it. So yeah, last year, let's see. Well, there's lots of different pages on this first.
That's the discussion of it, if you want to show
That's
that.
a discussion of the different discount rate on page 38. So the rate that they expect to earn,
Yeah,
that shows just if it was at, because right now the discount rate is 7.75%, they expect to earn 7.75% per year. And so that just shows the sensitivity, if they expect to earn a percentage less, that would be your liability for the year. 1% more would be an asset. Let's see if I have that number in here from last year. Should be on the financial statement. So on page 30, or 55, sorry. There's a schedule that shows different PERS, and this is also something that's required because of the 68. And so last year, we had an asset of about $1 million, and that flipped to a liability of $2.5 million. Though in 2014, if you reported it then, you would have had a liability of $673,000. And that wasn't totally major for everything, that was just kind of their rough estimate for the beginning year, because that was the, 2015 was the initial year we had to go to gas in 68. But because of the fact they changed those, that more decision changed the other decision made by the court, decided that was not correct to do. That's why it flipped so badly.
Well, I don't think we probably have enough time in today to get me to understand everything you're saying, Carrie, but, you know, I'm basing my question kind of on, when we're talking 2.5 million, we're talking 600,000, we're talking a liability. And then, as Ann has been sharing this week on the early projections for a 35% PERS increase of $160,000 to $180,000. But these liabilities are way more than that. I don't know how we completely understand what our real liability is, because we've been paying into the system and we have people retire and they receive their
Right.
benefits. And we're gonna see this monumental increase because of the
And you're not gonna get an
shortfall.
exact amount because, I mean, the liabilities they book are based off of an actuarial study, which takes into effect what they expect you to retire, you know, expected date of death kind of a thing, average on that, how long they expect you to work. And so there's so many different factors in there, you're not gonna get a good answer for that, that's an exact amount.
And because we're part of the pool, we're part
Correct.
of the local government pool, we don't even have data just specifically for us.
Nope.
So this is our share of the pool's exposure as well.
Yeah, because they take the whole state PERS system in general, and then they break it out on percentages to each district that has PERS. And so it may or may not be correct on that either, so, you know, it's kind of a, exactly.
So the longer people live after retirement, the more exposure we have.
Or the longer they work before, you have it less, you know, because if they're still paying into it until you retire at 75 compared to 60, let's say.
Gotcha.
You know, you're still paying for their 15 years. And so there's so many different factors it depends on. The one thing that we do know is, Ann's been talking to you about, is the rates are gonna increase largely
Yeah.
in the next 4 bienniums. I mean, I don't know what your guys' rate is, but
Let's
ours
not,
is
I
quite a bit.
don't know that we can go out that far yet, because
Yeah.
let's hope that,
Well, that's what, so far,
That's a
so unless they do
Yeah.
legislation of change, I think that's what you're looking at.
yeah.
Yeah,
Okay.
like say,
I'd probably 3 bienniums now, because the first one, they've already come up with the rates on.
So the message today says you can't retire till you're 85.
No more retiring, huh?
I can't anyway.
Well,
We just changed
no,
it.
retire so we know what your cost is. Then we'll have a known figure.
Yeah, if you retire at less than full benefits, maybe that would help too.
Well, we just changed the life expectancy down by 3 years, then all that liability goes away. I mean, that's what they do.
Yeah, except for it's backwards, life expectancy went up by.
Yeah, that's what I'm saying,
Yeah.
it just keeps going up and then liability.
That's your hard thing about a defined benefit plan, because you're trying to predict all this stuff out in the
Yeah.
future, that's, you're not able to predict.
You know, that's, just thinking about one agency that's PERS, corrections, state corrections, for their officers, their life expectancy is not very long after retirement. So the number that they use for you're gonna live to this, doesn't even come close to those PERS employees' life expectancy. It's, you know, some of the PERS employees' positions are pretty stressful and their life expectancy is a lot.
So police and fire are in their own,
Is it
Segment.
different?
Yeah.
Oh, okay.
And they actually can retire a lot earlier as a police and fire. A lot of
Yeah.
people I've seen actually do 2 careers of.
that's local
Police and
government,
fire.
state and federal government all have those programs.
So the life expectancy of law enforcement is down less than
Most likely, but,
other.
But they're in their own
Category.
category,
See,
they're
I'm in
outside
one
of
of
it.
those,
again, that's all based on
I'm in
estimates.
one of those not
Actually,
live very long after I
Mhm.
retire categories.
But then you don't ever retire.
That's why there's no way one can actually.
That's why you wanted his birthday to be, well,
Yeah, 1960.
so so we talked true numbers, our tier 1, tier 2 rate is going to 19.9% of payroll starting July 1st, 2017. That does not include the 6% employee pickup. So we're looking at almost 26 cents per dollar of salary that we pay will go to PERS for the tier 1, tier 2, which is our highest.
That's pretty common, at least that amount of
We,
increase.
we don't have a lot of tier 1 left.
Not a lot of tier
We
1,
have-
have some tier 2.
We have quite a few tier 2, but not a lot of tier 1.
Same,
For the tier 1 and tier 2 is the same, right?
yeah.
Oh, okay.
It's just the officer is a different rate.
I'm tier 1 just by a little amount. I think you're part of tier 1, aren't you?
Tier 2.
You're tier 2.
Tier 6.
I look at my retirement and I'm just tears everywhere.
Of joy.
Either you have happy.
Can't retire. Anyway, we're getting off subject. Anything else that you can think of?
I don't have anything else unless you have specific questions. I mean, I could go through all the financial statements if you like, but usually it's a good nap time that way, but.
I'll go ahead and take an opportunity then to point out a few things that I think this document actually is useful for. For those people that don't want to read all 100 and however many pages. There's a few letters right at the front that kind of give a brief snapshot and overview. There is, at the back of the report, a statistical section that looks at 10 years of data. There's actually some interesting facts in here about our employment numbers, our biggest property taxpayers, and just, you know, how we're accomplishing some things. So I think that statistical section in the back, this is what makes it a CAFR, is useful at times. So I guess I'm just pointing it out. Remember that this is here if you ever need to have this information.
That gives you a bigger picture.
It gives you a good history and kind of trends, it's really good to look at. And also, I should point that you guys did get a certificate of achievement also, to the FOA again, for the CAPR for June 30th of 2015. So hopefully we'll see another one next year, because we did some of it again.
Everything's awesome. Well, Poster Profession helps us out tremendously with this report too. So it's a nice partnership, and we continue to learn and improve and work through all the GASB statements.
I think 68 was 54 pages or something, I didn't read all of it.
God bless you for reading. Let's do it.
Can I ask you a question?
Yeah.
Have you, since we're the executive board of another body, which is South Central Oregon Economic Development Group, have you ever been contacted about submitting a proposal for doing their audit?
I'm not, no. Not that I'm aware of, and I've been there 8 years.
Yeah, well, this would have been within the last year.
Yeah, but I don't remember seeing anything like that.
Are you interested in receiving one?
Yeah, it would be.
Okay, thank you.
And we're always there for questions if you need anything or that kind of stuff. We'll probably plan on coming back again in July or to do some interim stuff for tax office and that comes in with normal. And I think the September date's been working well, somewhere around there, so. For the audit, because it's not quite as big as you guys are, it's hard to do it before that with all the 60-day accounts payable, receivable testing you have to do, so.
I do appreciate that.
It seems to work a lot better, doesn't it? That August was way too much for
Yeah.
you guys, especially when we had to come back and it just didn't work well, but so I think it's been working really well that way.
When will you know the September date?
We usually start scheduling after tax season, it's about May, you'll start hearing from somebody. But we should kind of try to keep the same if it works, and so if there's any days that doesn't work for you guys, you already know.
It might actually work on October.
I was thinking
Is
of
it October this year? September the year before then.
Right, early
Early
October.
October.
Yeah, it wasn't hunting season, I know that.
Got a little small window between that.
Well, this year's a big birthday celebration. I'm gonna take a big trip. I don't know where yet.
Somewhere.
I'm going somewhere.
I mean, if the big 3-0.
Yeah. Yeah, that would be a lot. I have a child that just turned 31 yesterday, so no.
They call that smoke and mirrors.
I think I'm pretty good at that nowadays.
So Carrie, unless the ladies have anything additional, Kevin's with us. I don't know if you've met Kevin Hawk, our new road superintendent.
Oh, okay.
Yeah. Here for a variety of things, including here in the audit report.
Well, thank you for having me, I appreciate
Thanks,
it.
Karen.
Thanks for driving all the way down here, Gordy. You're probably excited to get out. What do you guys have? You're in feet of snow up there, aren't you? Feet?
It's getting better, but we have no.
Again today.
Yeah, we're supposed to get less than an inch today, though, so it shouldn't be too
So
bad.
Carrie, as I mentioned to you when we started, you had a few minutes early that someone may show up late.
Okay.
This time.
I believe you said general public.
Oh, Thank you very much.
Yes.
Did you guys have options for interactive on the screens? Instead of driving all the way down?
I don't think so, actually. We don't have that kind of technology very well. We could go to the ESP. We don't have anything like Skype or anything like that.
I think last year Kara might have called in, but so,
I don't know how it done last year, possibly. I don't remember, it all goes together.
Yeah.
Might have been on the initial exit thing or something that she called
Oh,
in when
maybe.
you guys came down for a presentation.
okay, thank you so
It all
much.
blends together. We've been talking about the school district all this time.
Yes.
Thanks, Karen.
Well, thank you guys, I
Thank you
appreciate
very
it.
much.
Drive safe.
Thank you.
Love you.
Nice to meet you.
I don't think I need it anymore.
So, man, don't go anywhere.
I won't.
Well, there's no surprises.
I think we got it
I didn't
all.
feel it too much.
Since this is going to be when we open at a public hearing, do we hold two of these on the supplemental budget?
We open the public hearing and take public comments and then do the resolution based on.
So we don't have to have two hearings, just one?
Yes, sir.
Well, my watch says 10:30.
Okay.
So we're gonna open up the public hearing on the mental health supplemental budget at this time. And before we ask for public comment, maybe you can give an overview and then we'll have it available for public comment.
So as it's been publicized and discussed for quite a while, we have contracted with Lake Health District to provide Lake County mental health services. When we estimated and adopted our budget last spring, we weren't sure what that was gonna look like. So now that we are in the actual business of contracting with them, it requires some appropriation changes for our budget. We have in our contract provided all of our funding to the health district, and they have assumed all liability from that date of that contract. So even something that happened 2 or 3 years ago, 4 years ago, they're assuming that liability. We had set aside reserve dollars for potential liability scenarios. This supplemental budget allows us to release those reserve dollars so they can be part of the contract payments to mental health, Lake Health District. When you budget a reserve, you do not appropriate it. You're telling the public, this is a savings account, we are not spending it. To allow us to spend it on the intended use, we allow the public to make comment, to voice concerns, whatever opinion they might have. We involve them in the process before we appropriate the reserve. It has been published in the newspaper. I think I'm not sure if you have that copy with you, but it's,
We have to talk.
great. So it's notified to the public that way, and then we notify the hearing and allow for public comment. Is that good? Any questions about how this works? And, just to provide a little bit more information, we are continuing to get 2 payments, for mental health services that we've received in the past. We are getting the GOBI payment, which is Greater Oregon Behavioral Health Inc. Okay, great, Inc. We get that money based on capitation rates, we get that monthly. We also are still getting the state contract dollars, we get that monthly as well.
That's the Orange Street, right?
Oregon, it's, Oregon Health Authority, and actually they call it something different when it comes in. So we're ranging anywhere between, it's around $80,000 to $90,000 a month that we're getting in that we then have to transfer to the Lake Health District. So until changes are made with those contracts, we are in a position of passing through these dollars. Next budget year, if we don't have any knowns on these contract payments, we will still continue to budget to pass through payments.
So we've chatted about that a little bit. What's the process again for it to be able to go direct to them instead of through us?
I believe, this is kind of secondhand information, I haven't been involved in some of these discussions. I believe the GOBI payment can go to the health district once certain
Criteria?
have been met, maybe even, things put in place. I think that payment can be transferred sooner. The state contract with Lake County, I believe, stays in place until we are no longer the mental health authority.
You're exactly right.
That's
So-
what I thought, yeah.
As long as we are named the mental health authority, we will receive that contract. Well, we're agreeing to the contract and therefore the payment. So it will be a discussion between the boards and your mental health advisory group probably on who should be the mental health advisory.
I pulled down quite a bit of information. I'm not going to say I'm that fluent on it, but being the mental health authority, the advisory group reports to us, not to the health district. And there's some compliance things they have to do. They're working on their bylaws and working with them on that right now. But as a mental health authority, those certain dollars still pass through us. And it's basically a checks and balance thing as the mental health authority. The only way that I know is to completely give up that to the state, and I'm not sure that's the right thing to do.
So we give it up to the state and not the hospital?
You have to, I think you give it up and then,
They agree?
I don't know, Dan, I'm not, I would botch it all up here in a public meeting. I'm
Yeah.
still researching it.
We're still considered the mental health authority.
Yes.
Unless we vote ourselves out, and then the state will.
Yeah.
Reassign.
Back when I first came on, we had Lutheran, and we had a scenario where the money was passed directly to them without us, and that caused some problems back in those days that had yet to be resolved.
No, I think it still passed through us. It's just their allocation of the dollars might not have been the right intent.
There's one fund that was directed to them. That caused.
Okay, well, we can leave this public hearing open until the end of business, or we can close it.
I don't anticipate.
I don't either. I'm fine with closing the public hearing if everyone
Yes.
else is. We'll close the public hearing
Unless Kevin has some
on the
comments.
mental health supplemental budget at this time. And we'll open it up to any discussion with the board relative to it.
Well, I was just gonna make a motion based around there is no public input, and so I'd like to make a motion in the matter of supplemental budget and reserve balances to accept resolution number 2016-07. And I guess being supplemental budget, I'll read this one part down here. It is hereby directed that salaries decrease $300,000, contingency decrease $6,451, capital decrease $28,206, reserve decrease to zero, and materials and service increase to $834,657. For the record.
Second.
It's been moved and seconded to approve the resolution number 2016-07 in the matter of the supplemental budget and reserve balances, and all of the amounts are duly noted for the record, so I won't repeat those. Any other discussion? Hearing none, all in favor?
Aye.
Aye, motion carries.
And thank you for getting that all taken care of.
Yes.
Now, I haven't, since we talked last week, had any, I don't know, Denise, if you've been contacted by our next
I have not.
presenter.
Further.
We have a few minutes before 10:40, that timed item, and we need Mr. Bailey on the phone for not only him, but pretty much everything else that comes after it, so I would suggest we take a recess for the next few minutes. And if the claim shows up here in the next few minutes, we'll promptly get back, and otherwise